Let's talk osteoporosis today, guys. Osteoporosis is so common within women, especially over the ages of 60, 65 years old, okay? I want everybody to be on the same page though. So what is it? Osteoporosis is when you lose bone density over the course of your lifespan. And as you can see with the illustration I have up here, on the left-hand side, we have our healthy bone. Look at that bone. Do you notice how the center of it, it's very sponge-like, right? That's what we call trabeculae, and there is a lot of it, which is good. And then if you look over on the right side of this illustration, you can tell that those patterns are just not as prominent, right? There's more gaps within the trabeculae, which isn't good. That's your presentation of loss of bone density there. You can even see in this next illustration here, from left, great bone, to the right, also that lack of trabeculae. Why I'm even bringing this up? Well, the number one injury-related death over the age of 65 years old is due to falls, especially when you sustain a fracture from that. Women represent 3/4 of these cases because of osteoporosis, because of bone fragility, okay? Now, to go into a little more physiology here, I want you guys to just be able to understand how this whole process works. We have two types of cells. There are more, but to keep this simple, there are two types of cells. There are osteoblasts, which are in charge of the formation of new bone. They lay new bone cells. This happens every day. And then we have osteoclasts. They clean up the old debris of old useless bone cells that are no longer doing us any service. This process is crucial to happen nonstop all the time, so that way we can continue to regenerate, just like every other cell in our body. We need our bones to continue to regenerate so that way they can remain strong, so that way they can continue to allow us to do all the activities day in and day out. Now, how do we allow this process to continue? It's through good, healthy stresses on the body. It's through working out, lifting heavy weights, playing with your kids, movement. Movement is how we continue to allow this process to take place. So as you can imagine, over time, we move less, right? So that's definitely a huge part as to why we become more osteoporotic with age, and there are a few other factors that I'm not going to get into today of why it's so prominent in women. But the takeaway here, there was a study that was conducted, and they took patients over the ages of 80. And what they did, they went under consistent chiropractic care for the course of 12 weeks, and they took some baseline measures, so how quickly they could walk, what their reflexes were like, what their proprioception was like. And they saw within just 12 weeks, huge improvements in their sensory motor function. They were able to have better joint position space, which means they were also more confident in walking. They were more confident in taking the stairs. They could react better to their environment. Overall, these patients now had a better quality of life just through 12 weeks of chiropractic care. Every time you get adjusted, we are allowing this process to take place. We are creating movement. We are creating healthy stress on the spine. So that way these osteoblasts continue to lay down new bone, and these osteoclasts continue to clean up all the old stuff we don't need anymore. But what a better way than to finish off with a patient testimonial. I had a wonderful conversation with a patient last year, and I asked her, where would you be if you weren't getting adjusted? She told me she would be frail. She would be weak. She would not be able to enjoy the time with her grandkids like she does now. She is more confident to play with them, to do activities with them, and to just do everyday life. She was somebody who had decreased bone density. And she told me that through chiropractic care, her bone density scans have come back in a positive way. Her bone density has increased. And I believe this patient's in her 70s. That's just something we don't see in the general medical community. They just give you medication to keep you afloat and make sure we don't see any further degradation. But how about the improvement? Have a great Thursday, guys.